to meet the needs of everyone.
To be free at the point of delivery.
To be accessed on need and not wealth.
Thank you very much, Boo, and I'm really delighted to be here and was pleased to be asked. I hope that I can add to some of the discussions that you've had this morning, and I started by reminding us all really of the wealth of innovations that we have in the NHS already and what a world leader we are. And as we go into this new age of innovation and discovery, all of the lessons that we've learned previously and the skills and innovation that we have will help with the future. So I'm going to outline the strategic context of AI, but I'll start by saying why I think our collective work is important and introduce you to some of the work at NHSX. So I've worked across the NHS for 28 years and really enjoyed working with Boo for 3 years, and just about managed every service. So I'm extremely proud of the work that we all do. I work with some of the most inspirational people over my career. I've been astonished by the advances in medicine and really proud of the compassion and kindness that I've seen as staff in the NHS every day. So whilst there's much to be proud of, there's much more that we can do. So we know that demand for healthcare far exceeds capacity. We know that all the great advances that we wish to provide for services need money and come at a cost. And this is why we need to use our skills and vision collectively to develop new pathways, platforms, and speed up how we undertake our work. So across the world, the health sector is under pressure. We're not alone. And we are living in an age where advanced analytics and technology may be some of the silver linings that we're looking for. So it may help us to achieve things that we didn't know were possible. And the work that we do together will sustain and advance the work of the NHS. And we're here today to continue our communication support to yourselves as innovators. So just to say a bit more about NHSX, you will know it's really new. So we launched in the first week of July last year. And we really wanted to bring together the work nationally on digital innovation, and we combined the senior staff at the Department of Health and Social Care and the Department of NHS England to have one agency that would accelerate digital innovation within the NHS. So that was really important because people were getting conflicting messages between all of those agencies, and we had a Secretary of State that wanted to send a clear message to health and to all of our commercial partners that we're more serious, and we're really serious about this, and we see it as a major factor within healthcare moving forward. I'll just say a little bit about our missions, and we've purposely described these as missions because these are the main ways that we feel can support your work and support all of our work in improving healthcare. So we want to spend a lot of our time on reducing the burden within our workforce. So you will know, and I know, that a lot of our jobs sometimes are dealing with paperwork, and actually we want to spend much more time in front of our patients, and this is some of the presentations and questions this morning. We want to really get underneath some of the issues with data, and this is quite a big task, as you can imagine. So there's two aspects to this. The first one is making sure some of the data governance aligns. So a really big task. We have a data guardian, information commissioner's office, and a variety of governance and guidelines that we'll need to work through if we want to advance the work, our technology and analytics within the NHS. And the other side of this is to make sure that patients can see their information much more easily. And if this is electronic, of course, it gives us more capacity and capability for doing this. And remembering that all of this data is patients, it's their own data rather than being owned by ourselves or different commercial companies. And then the final two areas is thinking about how we can speed up some of the areas within the NHS, how we can improve safety. And certainly in my previous post working at King's, the implementation of our new electronic health record across of our 5 sites massively improved safety. Really, it's one of the most important things we did to improve safety within that organisation. And finally, thinking about how we can improve productivity. And this, again, goes back to making the most of the time of individuals, because we know that we have shortages of staff and the demands are growing. So we've done a lot of work with individual innovators and innovation companies, and some of these are people like yourselves working within the NHS, and some are companies that partner and sit alongside. So one of the issues that we have is that there are some fantastic examples, and they're quite isolated in some of our organisations, and often getting those to grow and scale is quite difficult. So we've been listening to innovators to say what makes things really difficult within the NHS, and published a report last year that fed back on the 5 areas that colleagues identified. And the first one of those was standards, interoperability and integration. Both NHS colleagues and commercial colleagues were concerned around how that happens. And I'll say a little bit more about that later, and a consultation that we just launched yesterday in this area. Procurement, some of the procurement frameworks and mechanisms do not lend themselves to some of our digital innovation tools that we have at the moment. So we launched at the end of last year a new framework. It's called Lot Zero, or the Innovation Greenhouse, as you may have seen it in the press. And we have, I think, over 100 innovators now have joined that framework. And the reason this was so important is often if you have a digital tool, some of the questions that were asked previously, such as do you have 5 years of data, it just isn't relevant because the technology changes so quickly. So that procurement framework was launched. There were some concerns around digital capability within the NHS, and we know we have varying capability, and I suspect we've got some of the best of the capability in the room today, but often people are wedded to certain ways of working that we need to support and change. And show people the advantages of some of the new technologies and where it could fit in their daily work. And companies asked us for some help with approach scaling tools within the NHS, but also how we engage with each other and how we communicate areas of good practice. So this is the document, and we'll be reproducing that next year, because we hope that we've worked on all the things that were identified last year. So before I started my job in September last year, I did do a lot of work with providers across the NHS to say what are the main issues that you find. They were also concerned about standards and interoperability, financial assessment of products. How do we know something works and it does what it says and it's value for money? How do we know what's out there in the market? And there was a feeling that often innovation is product-led rather than needs-led, and I think most of you will have been in a situation where you've looked at lots of different products, and sometimes they don't quite have all of the features that will make the difference for your particular clinical pathway. So that links between clinical teams and operational teams and innovators and technical staff is really, really important, so we do the right thing that solves all of our problems. And of course all of these initiatives take a lot of investment and time to implement, and we can't forget this. This is a really important factor in making sure that the innovations work well. So I'm just going to say in a couple of slides that some of the things that we're doing, and we started across NHSX, and I'm really keen to hear your views on some of these areas, and then I'll give you much more detail on the AI work and then the AI funds. So, of course, all of our work AI is a fantastic innovation, but it needs to sit within infrastructure that we collect data appropriately. If we do it electronically, we've got much more chance of sharing that data and analysing it. So this has to sit within a framework of services that work well and clinical teams that can communicate with each other and with their patients appropriately. So there's a lot of work that we are doing on really explaining clearly what the innovation pathway and all of the regulation and areas that you need to cover if you want to bring a product to market. So that's been a very large piece of work with the Accelerated Access Collaborative. So we're pleased to do that, but also pleased that we're working really closely with the MHRA, with the CQC, with NICE and with other colleagues. We've agreed that we'll work collectively so we don't publish different types of regulation within the system, which has beleaguered us for so long. There'll be a number of areas that will scale for high impact, and I'll say a little bit more about those areas later, and a small number of priorities that we have funded and will implement across the NHS, and single sign-on is one of those that you will have heard of. So in response to some of the feedback that we've had already from providers, we can do a lot of work nationally on being very clear about areas that work well, supporting with the evaluation for these, and making sure they're widely known across the NHS system. And this is in response to feedback from colleagues in the NHS saying, actually, I'm not sure which area is relevant to me, and I really don't have time to review 20 or 30 products. Can people support with that? Of course we can, and we'd really like to do that. So we are doing a whole range of work around getting case studies for areas of good practice. We always promote the NHS institution that they've worked with, as well as the partner, whether that's academia or other institutions. And we've formulated our work into a partnership, and these we're getting together with the Advanced Access Collaborative, which is part of NHS England, who promotes innovation in pharmacy and medtech more broadly, to produce an innovation portal for all organisations. And we're expecting that to go live in the autumn. So I mentioned a little bit about assurance and evaluation. I won't say too much more about this, but I'm hoping some of the questions come up within the at the end of the talk, because there's a lot to do really in figuring out how we can move forward on AI and thinking about the clinical governance and guidance that we can do nationally, but all the decision making and governance that you will need within organisations to take some of these areas forward. So I'm happy to say a bit more about that later. Just to talk briefly about work we're doing on mapping innovations across the NHS. The slide deck, which has got all of this in, has got much more detail, but we've been looking at where innovation is and where it isn't, and where it could potentially help. And we've also are working really closely with global innovators. So at the end of last year, colleagues will know that we've had a collaboration with Alexa, and all of the syndicated content, which is on NHS.UK, which receives 65 million views a month. If people would like to know the input of their work, so thank you for everybody who's been busy syndicating that content on NHS.UK, and how can we transfer that to really easy ways of people reviewing that if they ask for signs and symptoms on Alexa, and we have some other initiatives in the future, which I you'll hear about over the next few months. But this is really to get information that clinical teams have produced out there much more easily. We have a rule with our work with major global companies. It's all been free to date, so we're really grateful for that. I don't see that changing, and that's been a really useful and I think increasingly important role that we'll play. And we have been asked by the executive of NHS England and also our local innovators just to say something about what the priorities are. So NHS England have been very clear about priorities, and these are really on areas of pressure within the system. So I hope these are areas where you think actually we need to many more tools and techniques to help us. So we know that in terms of our workforce, there are some things that are really clunky to use within the NHS, and within my previous roles, I've spent a lot of time trying to make things less clunky, but actually we all spend time doing things where, which is really either not operating at the top of our license, but or areas that are more important, and we're weighed down with things. So we think we can do much more around improving the ability and capacity of our workforce to spend with patients. We are looking at how we support primary care. And I was at the Royal College of GPs yesterday, just talking to a collection of innovators there, just thinking about what systems and structures would help them most, thinking about the flexibility of workforce and technology really happen with easy communications and straightforward systems to offer them more flexible ways of working, but also speed up some of the processes within their workplace. And finally, this is an area I've been working on for 15 years and still wanting to improve, and certainly some of the work I was doing with Boo was to think about how we can make our outpatient pathways more convenient, easy, more faster access to diagnosis and treatment, and use all of the tools and techniques in modern technology towards looking at how we undertake outpatient appointments. So happy to say a bit more about that later, but certainly within my focus of my time, I'll be leading on the digital outpatient work nationally, and I'm really excited about that. So just a couple of slides that look at what we're doing around standards and integration. So we launched yesterday a consultation on digital health technology standards. So there are a number of standards within that we've asked for your advice and your feedback on. So rather than publishing a document and said, great, we've done it, here you are, this is what you need to follow, all of our documents, and you'll have seen that yesterday if you followed the launch of the NHS plan for tech. All of our documents will have an extended consultation period where we put out some principles and suggestions, and we ask for your feedback. The areas of integration is really, really important. We know that, and it forms the premise of how we get data from one system to another and how we can join up some of our processes. So we've launched a consultation on that yesterday, and I'll give you a flavour of some of the areas in that. And here's the timeline. So we will be refining the standards based on feedback until the end of spring, and hope to publish that in summer. So a lot of you will be familiar with this document on AI and how to get it right, and this was our attempt to summarise good practice and give some guidance to the system. And in the award of the AI monies, there were some two really clear areas that we wanted to address. The first one was the development of an AI lab, and some of the discussions that you've had that I listened to on governance and how do we take things forward, those really difficult questions on when's the right time to go live, what will this mean for our practice. We need some really comprehensive guidance on all of those areas. So that's the purpose of the AI lab, because you will know thinking through all the governance systems that we've got already in the NHS. They're really suitable for pharma or for other areas. How do we construct this governance framework to make sure we're all confident to move forward? So there's actually a big task for this piece of work, and it will need everybody's input to make sure we get it right. Interestingly, we do a lot of work internationally, and we have a lot of eyes on us in terms of AI, because we have made a big award, as you're aware of, but we've been really clear that we will work with regulators to make sure there is one form of guidance and regulation around AI, so there aren't competing interests. And we meet with all of the regulators, NICE and CQC, MRHA and others on a quarterly basis. All of their chief executives are in a room, and we started that just over a month ago, and we're committed to making sure that we all agree that guidance. So there's a lot of work to do on to provide evidence of what good practice looks like and that we take patients with us, because the worst thing we could do, and I'm sure you feel exactly the same, is for people to be really nervous about what their data's been used for, and the premise when they give their information to any of us. So I wanted to say a little bit more about the monies and the award, because I know it's live, but just to give an overarching infrastructure and purpose for the AI award. So this award is to make sure that we can scale, and we have some really good case studies of AI within the NHS. We know this is really expensive and difficult work, and it needs to be properly resourced. So the purpose of this award is making sure we can advance artificial intelligence by having some really great case studies. And that is what we're all working to. We know those will need to be well-resourced, evidenced. So we're currently linking with a whole range of organisations that will support the review and the research and the evidence around those case studies, so we can make sure they're established programmes of work moving forward. So just thinking about the AI life cycle, the AI lab, which is the regulation and building all of that infrastructure and governance. You can see on the left-hand side there, sorry, on the right, my left-hand side, your right-hand side there, and on the left-hand side over there, you can see the AI awards and programmes that we've got. So just to move on to say a little bit more about the award, you can have these slides afterwards, but we will be moving through technical feasibility, evaluation, real-world testing, system adoption, and national scale-up. So these are the key pieces of work that we will anticipate for people who are interested in applying for the awards. There are much more information on our website, so which I'll put up the details on the end. And just a few more pieces of information. The award, we're actually going to make 2 awards a year for the next 3 years. So if you feel that you're not ready yet, and you have some further gathering of work that you need to do, we do have some time for you to submit your award, and the initial award will be small, I think, for this over the next few months, and we're expecting a large award in July, just to give people time and for them to get used to the eligibility criteria. Okay, so I'm just going to end there with some links, and this is where you can get all of the information for the award. I would say at this stage we're learning along with you on how we adapt AI to the NHS. It's new territory, but I do think we have a history in our health system of innovation, and all of those skills around making sure we research, we test, we evaluate, and we look at how we can scale and implement. All of those skills are appropriate for the work that we need to do moving forward. So I will leave it there and see if I have any time for questions.
If needed, I can see some people have already opened up the web links and probably filling in their application forms as we speak. There's a couple of questions right at the back of the auditorium there. Is that Ralph? Vish, hi.
Thanks, Bo, for the excellent and exciting conference today. Just a quick, is AI Lab is going to be equivalent to NICE, or in addition to NICE, with another step in the process of adopting this new technology?
Sure. So what we're doing is we're working closely with NICE, and NICE will evaluate. So we didn't want to replicate, because it just gets slightly confusing of having lots of different regulators reviewing products which are quite similar. So NICE will do the evaluation. In terms of the national policy and national regulations, we will do that as part of the AI lab. We are funding NICE to do the evaluation.
If you can just pass the mic backwards there, thank you.
Thanks to Boo. Fantastic meeting, and you can see all the excitement. And thanks, Lisa, for your talk. I was going to ask, I work in Birmingham at UHB, and we use IT quite a lot. But many of you might have seen on Newsnight on Monday about Babylon, which is quite, one of the quite advanced GP platforms. And in terms of, perhaps getting that right balance of being cautious and going for it in terms of the innovation, are there any specific things analogous to GI where you think they're doing it right? Because just in terms of, physician do no harm as well as treat the patients.
Yeah. So is that Babylon specifically or UHB? Is that all? Because I know you've got a partnership with them, haven't you, in terms of A&E and other.
Yeah, I mean, I don't
perhaps
personally
not
have
you
a partnership,
personally,
but we work
but,
there,
yeah,
But
UHB
it
does,
featured on Newsnight,
Sure,
and
yeah.
so just.
Yeah. So all of these things need testing and evaluation in the same way we would test and evaluate any other new service, new technology or new drugs. So I think time will tell really for all of these products. I think where people will be successful is that close collaboration and co-creation with the NHS will be really important. We're already seeing suppliers that work very closely with clinical teams. Their products are much, much better than organisations that don't. But we have a lot of products out there on the market, and I think over the next 3 to 5 years, things will change quite rapidly, and the successful ones will be the ones who have got really strong evidence, who pitch their cost appropriately, because there are still some organisations who have pitched their cost outside of what's affordable, and have products that fit within the clinical pathway. So if we have products that actually people can't imagine using, or it doesn't fit within a normal clinical pathway that we all understand, it won't work. So time will tell.
Thanks very much. I think we'll call it a day there, but I would like to say that I'm really impressed by the speed of how this is all happening and how you're really sort of grappling with it, and to have a meeting last week and then produce a document in summer of the same year is going to be that's really encouraging to see. Thank you. Thanks so much, Lisa. Thank you.